Okay, we are now in week 9 and we're moving through. I want to make sure that you always start off on this front page here, and you can see that the due dates are here each week. You have a discussion post and assignment unless there's a quiz or midterm that week. And I've updated to land on Monday by midnight to give you a little bit more time. Your chapter reviews are posted each week with due dates, but it does not close to December 1st. So that means that you can keep doing that and get your score up as high as you want. Also, I wanted to show you that you can go to your setting. I'm going to go ahead and do a student view here, and I'm going to get to grades in student view. And I want to show you that you can put hypothetical grades in here and actually see that if you scored a certain thing, how would that impact on your grade? So right now, the student hasn't been submitting anything. This is a test student, by the way. And you could see that you can actually play with your grade and see how it impacts. I'm using a weighted system, so that means that each thing is weighted a certain percent. The more points you get in that system, so if you get an A and you get all the points you can, that's 10% of your grade. Your quizzes are 20%. And you can see how this adds up. So it's whatever your grade is times a percentage, and then it adds up to the final percentage. But use the Canvas option here to play with your grade to see what that means to you specifically. Okay, so now I'm going to get out of this, and I'm going to go back to my dashboard and move out of this. Reset. Good. Okay, great. So now I'm coming back into my personal health and wellness. Good. And I'm back in here, and I'm going back to my modules. And right now we are in week 9. So I'm going to give you a quick overview of the cancer PowerPoint, and then know that you have a homework that's due. I'm going to go ahead and put that due date for, I'm going to change that to be done. I would suggest that you should get that done by, I would say that if you're on top of everything, you're going to get that done at least by the 29th. Okay. And then, but it doesn't close until December 1st. So that means that you could keep working on it. And that's just a hypothetical deadline to kind of get you to stay on top of everything. So that's your chapter review. Again, not due until October the 29th, but doesn't close until December. So when something doesn't close, that means you're allowed to keep working on it. So you always need to look at the close date. Look at this. This is assignment week 9, and it's worth 10 points. It opens, it's due October the 23rd, which is a Monday, and it closes October 23rd. And this is your assignment here where you're going to pick one of the cancers, and then you're going to answer these 3 questions. So you pick one cancer and then answer these 3 questions. And then this is something you upload, and it's worth 10 points. Again, that is the firm deadline. That's an assignment. And then I have a discussion post in here. Same deal. It opens, and it's open now, and it will close on October the 23rd. And it closes on October 23rd, so that means you need to get it in. And this is a discussion post, and I'm going to ask you to put down your thoughts on HPV vaccination or tanning beds. You get to choose one topic. But here are the 2 things that you need to have in your discussion post. One, if you have any opinions or research or any facts, you need to make sure that you're backing it up with facts that are cited. So you have to cite something, because you remember correlation does not mean causation. It means that just because something is a relationship, it does not mean it causes it. So one of the big things that you need to do as a health educator is not put in your opinion, but always cite facts. It's up to the individual to make their personal choice with their medical decisions. you give them facts. So pick one of those and make sure you provide facts. The second is you need to respond to at least one person's post. You could disagree, or ask a question. Again, if you disagree, you have to have a fact, a source. If you agree, you need to put a source. You need to not just say, I think it's great. So I'm going to start looking to see that you always put facts with just a citation. And remember, good citations are peer-reviewed. So that means it's government, NIH, National Institute of Health, CDC, EDU sites. Those are all really good sources to cite from. Okay, back to module again. And then you also see that I've put down an HPV vaccination. CDC provides pros and cons, facts. And then tanning beds, I posted from a foundation that has a good overview of this. So these are good examples of providing resources to back up your facts. Now, let's go ahead and look at the PowerPoint here. I want to make sure that I'm sharing this with you. And we'll see here. Yes, I am. So I want to go over real quick what we're going to be covering this week. And here's the slideshow. This is reducing your cancer risk. And so I want you to describe the impact of cancer on people, explain suspected causes, know the different types of cancers, and then cancer diagnostic and treatment. So know that one of your assignments is to go over a type of cancer, prevention, treatment, and things to know. Know that it's embedded, the answers are embedded in this PowerPoint and are directly in your book too. So big thing with cancer is that it is the second most common cause of death in the United States, exceeded only by heart disease. But what's really cool about cancer is that it's really starting to be treatable and preventable, and we've watched the rates go down. You need to know that cancer is a large group of diseases categorized by the uncontrollable growth and spread of abnormal cells. So there's something called carcinoma in situ, which means basically the carcinoma is not spreading. So that can happen. But this is what you look for. You look for normal. So if someone takes a biopsy, this is a sample of the tissue, they look under the microscope to see how the cells are dividing. Normal hyperplasia means that they're starting to cell. They're not cancerous, but they're starting to divide at a higher rate. Dysplasia means that they're actually starting to look, they're not dividing in a normal way. So they look abnormal under the microscope. In other words, you will see that they're not well defined. And then it moves to cancer. Dysplasia obviously is a real risk factor and is something that needs to be removed or monitored. And when it moves to cancer, it means it's starting to spread. So then, terms that you should know. Do you know what a neoplasm is? It's a new growth of tissue that serves no function. A tumor is a clumping of neoplasmic cells. Malignant means cancerous. So it means bad, bad. Benign means non-cancerous. Biopsy is a microscopic examination of a cell development. And comorbidities means that it is looking at two diseases or more diseases happening at the same time. So this is a really good graphic of how a cell starts to move and divide. And then this is in situ, means it's staying in one place. But when it starts to become a malignant tumor, it starts to spread and metastasize. And it spreads and it actually starts to move through your body. So one of the things you know is that there's something called a tumor node metastasis. And this is where every cancer gets rated based on their size of the tumor, whether other lymph nodes involved, and the degree of how it's moved through the body, metastasis. These are the different stages. 0, early cancer, when abnormal cells remain only in the place they originated. So they are only there and that they have not metastasized. This is a good stage to be in. 1 through 3 means that they're starting to move and throughout the body. And stage 4, it means that cancer is spread to the other organs. So, this is a really good graphic here. Stage 1 is the basically that it's starting to metastasize. Stage 2 is it's moving through the body. And then here's stage 4. This is a great graphic. Risk for cancers. They're basically two things: hereditary, and these are, you'll hear about these, that people sometimes have cancer that's genetically in their genes and they're more at risk, and then environmental factors. And I find this is really interesting. According to some researchers, and this is cited in your book, 90% of cancers are caused by inflammation, of which 20% are chronic infections, 30% are related to tobacco smoking or being exposed to particulate matter. That's what PM stands for, so air pollution. And 35% are due to dietary factors. So here's some things to look at. Lifetime risk. This is how the probability that an individual will get that over a course of a lifetime, or relative risk, whether a person has a personal risk to the factor of getting a particular cancer. Here's some lifestyle risk: tobacco use, alcohol and cancer, poor nutrition, and then stress. These can all lead to higher rates of cancer. Big one is tobacco use. Genetics. 5% of all cancers are strongly hereditary. So that means that like 95% of them are due to lifestyle and environment. Cancer-causing genes are called oncogenes. So something to be familiar with is that you'll hear this term where some genes are causing and triggering cells to divide abnormally. But most cancers are due to lifestyle. Reproductive and hormonal factors, early menarche. So this means that having the periods starting early, or late menopause, not having children, recent use of birth control pills or hormonal replacement. These all increase breast cancer risk. This influence is seen in non-Hispanic white women, but does not have a strong influence on Hispanic women. So also ethnicity and genetics have something to play with this too. So there are a lot of moving parts when it comes to cancer risk. Occupational risks are huge. Having environmental risk are huge. Asbestos, nickel, chemicals, working with dyes, radiations, and chemicals in foods. All of these are something to think about. Infectious disease, you'll hear about this: chronic hepatitis B and C and liver cancers. These can actually stimulate the growth of cancer cells. HPV, one of the things that this is part of the reason why they're promoting the vaccine. Between 70% and 100% of women with cervical cancer have evidence of an HPV infection. So that's something to think about. And having exposures to ulcers and certain types of bacteria can, again, cause inflammation and then lead to cancer. There are also medical factors. We talked about this hormonal replacement. And then sometimes being treated for one type of cancer may increase the risk of other types of cancers. Here are the 4 types of cancers. Carcinoma, and this is with the surrounding tissue. So the lining of the intestines and body cavities is the most common one. Sarcomas, this is the one that's connective tissues like bones, tendons, cartilage, muscle, fat tissues. Leukemia is the one that's in the blood. And then lymphomas are cancers that originate in the lymph nodes and glands. This is an example of something that's cancer, carcinogenic here, cancer looking, and you can tell it doesn't look good. It's got abnormal growth, it's red, it's black, it's irritated, it's inflamed. These are the different types of cancers. You'll see that in females, breast is the biggest one. In males, it's prostate. These are new cases of cancer, but look how the deaths from cancer are different. Lung and bronch is at the top. And then it's followed for women, breast and colon and rectum. But then for males, it's prostate. And then it goes down. You can see that pancreatic cancer is one of the top ones. So you can see that that just because someone gets diagnosed with cancer, the rate of death is different. Big time. I'm going to go through these with a good pace. I'm not going to read every single of one of these bullet points, but this is where you can focus in on one of the cancers in your book. And then I want you to tell me what the prevention is, the treatment, and some things to think about. So for lung cancer, you can see how prevalent it is. This is one big thing, is lung cancer is one of the top. The symptoms, what they are, include a persistent cough. Treatment includes surgery. And the prevention includes obviously not smoking and environmental tobacco smoke. And I want to throw in there that marijuana is not up on this slide, but marijuana is carcinogenic. Breast cancer, same idea. I want you to go through this so you can see the detection, the symptoms, the risk factors, and the treatment. For each one of the cancers, I've done this. So look at each one. Colon and rectal cancers, how prevalent it is, how common, the treatment, the risk factors, and the prevention. Skin cancer. Here's what's very interesting. The most common type of cancer, but one of the most treatable. But at the same time, people do die from skin cancer. So this is one of the things that people need to keep in mind, is the ABCD rule. How does it look? Is this asymptomatic in the sense it's not completely, like one half does not look the same as the other. Border, does it look irregular? The color and the diameter. So that mole that I was showing earlier is a perfect example of one that looks pretty carcinogenic. So, oh, here we go. This is malignant. Look at it's not it doesn't have good symmetry. So you can tell that it's not round, and it's not equal looking. You can see that it's inflamed, and you can see the inflammation. Each one of these are different types of skin cancer. Risk factors. So having fair skin is a risk factor, but the reality too is that I was listening to a report on African Americans. Often you do not see the skin cancer, but they have skin cancer. It's just not as detectable. So that's something to keep in mind too. Obviously using sun protection and not doing tanning beds. Prostate cancer, very common, very treatable. But one of the things that they talk about is sometimes the early screening can be problematic. So they say that it's one of the most survivable cancers out there, but a lot of different ideas about whether treating, when to treat, and how to treat. Ovarian cancer, same idea. Symptoms, risk factors, and prevention. Cervical and endometrial cancer, very common, but very treatable. And Pap tests are how we look to see if cancers are, if the cells are doing dysplasia. Testicular cancer, leukemia, lymphoma. And so here's the big thing that people need to know, is that they face cancer. There's a lot of different ways to start to diagnose this. So MRI, CAT scans, ultrasounds, and then skin self-exams and checkups. So these are some of the ways to early detect. And then we've had some really good cancer treatments start to pop up. Surgery, radiotherapy, and chemotherapy. And one that highlight on new cancer treatments that I'm going to really emphasize is immunotherapy. And they've started to do this thing where they have smart drugs that come in and really target the aggressive cancers. So they've made some real big gains in cancer treatment. And in past, cancer was a death sentence, but it's not anymore. With some cancers, they've had huge success rates. So you need to know that there's a high survival rate now. We're starting to see some really good survival rates compared to the past. And so one of the big things with cancer is early detection and then really good treatment to target it and get it. So let me go back now and go back to to this week. And one of your assignments is doing a cancer overview. I'm going to go back to that assignment again. I want to make sure that you are seeing that. Good. So right here, you're going to choose one of the cancers. And I want to make sure that I put in there that you put down how prevalent it is. So how common is it? How prevalent is it? Oh, misspell. Thank goodness for spell check. Is the cancer. Okay. I can say how common. What are the rates? Rates of the cancer. I wouldn't say common, but for this type of cancer. So that's what prevalence means. So what you need to do is you're going to pick one cancer, and then you're going to answer these 4 questions and upload it. And then obviously for a discussion question, I think it's pretty clear. You need to pick one of the discussion questions here and then pull out facts. So you can get all this information from the PowerPoint that I just presented and also your book. Okay, so those are the 3 things you need to be working on this week is your chapter review for the cancer, posting for your assignment, and then your discussion post. Those are where you're going to focus in on. Make sure that you keep on doing your chapter reviews, even if you've fallen behind on them. Go back and get them all done. I'm going to be entering zeros in those so you can see how it impacts your grade. So again, remember this one does not close. Chapter reviews do not close till December 1st. These 2 this assignment and this discussion post do have a firm deadline of next week, October the 23rd. So make sure you get those done. I will have a Zoom meeting this Thursday. Make sure you participate in that, and I'll be posting that later so you can get the Zoom information and look at the video and get any questions that you might have answered. All right? Have a great week, and please canvas message me if you have any questions. If part of it being really good at an online class is not falling behind and making sure that you're up to speed with everything. How you can do that is by looking at your grades to date and making sure that you have everything posted you can. Go through each module and make sure that you do everything. So for this week, chapter review for the cancer, the assignment post, and the discussion post. Those are your 3 to-do items for this week, right? Great. Look forward to hearing from you. Any questions you might have, feel free to set up a time to talk to me if you're confused about anything. This is where you need to make sure that you're up to speed on everything as a student. You can still catch up if you're behind on anything, okay? You're still in a good place. You're still in the middle of this term, and you can do that. All right, great. Have a great week.